First Nation, Inuit, and Métis peoples disproportionately face inequities within the healthcare system. To address these inequities, it's important to understand that various dimensions of health inequities exist, which are commonly referred to as social determinants of health. Social determinants of health are broadly defined as the conditions in which people are born, grow, live, and work. Some of these conditions include education, employment, housing, health services, food insecurity, early learning, and gender. Typically, these social determinants of health are considered or viewed through a deficit-based lens. For example, when we talk about income, it tends to be presented as lower income equates to poorer health outcomes. Income, as defined through the mainstream model, relates specifically to currency. But from an Indigenous perspective, what is considered wealth can look very different, encompassing factors such as opportunity, acceptance, or different forms of currency like land, family, and goodness. To help position social determinants of health from an Indigenous perspective, the IPHCC collaborated with First Nation, Inuit, and Métis knowledge keepers from across the province to redefine the determinants of health from a strength-based and Indigenous perspective. And what resulted was our story of how determinants impact our health. Looking at the social determinant of health of employment, job security, and working conditions, our story identifies the essence of supporting this factor through flexible funding models that are self-determined for and by Indigenous people and communities, as well as adequate funding for administration of health services, and self-determining governance models of health that are community-led and community-based. This also includes having Indigenous governance at the decision-making tables with government and other entities. The social determinant of health, education, literacy, and skills often presents a negative picture, with lower educational attainment associated with greater risks of chronic disease and illnesses. But in our story, education and literacy skills consists of teaching our original languages, self-determination, cultural reciprocity, and experiential learning. These are found to positively impact holistic health outcomes for First Nation, Inuit, and Métis. Applicability strategies include adapting teaching strategies to meet learning needs, including Indigenous lens for Indigenous students, and providing adequate funding to foster the Indigenous education system. The Our Story approach to housing considers a clean, safe, affordable, and accessibility place to call home. Another social determinant of health that was redefined is disability. Disability is described by the Centre for Disease Control as any condition of the body or mind that makes it more difficult for the person to do certain activities and interact with the world around them. However, our story of disability is celebrating everyone's differences. Every individual has a gift to bring forward. As such, we celebrate everyone's abilities rather than consider one's limitations as a disability. Food security is another factor that was redefined from its current mainstream definition of a state of having reliable access to a sufficient quantity of affordable and nutritious food. Our story of food security means having an abundance of various traditional foods, such as wild meat, wild rice, nuts, and berries. Food security is having clean water, food sovereignty, connection to land, and sustainability, which speaks to the importance of protecting, respecting, and passing on knowledge of traditional ways of harvesting and gathering. Looking at the social determinant of health of early childhood development, our story considers positive early childhood development that consists of warmth, ceremonial teachings, a safe place for pregnant people to gather, learn, and facilitate knowledge exchange, extended and chosen family helping raise children, and access to traditional foods and teachings, land, and resources. In practice, this can look like more in-community births, changing the structure of intervention in child apprehension, acceptance of traditional birth practices, and providing space for Indigenous peoples to gather. With regards to personal health practices and resiliency, our story positions this social determinant of health as respecting, honoring, and valuing the diversity of traditional healing practices, respecting the choice of healthcare in our way, and utilizing holistic tools to support balance of self. In the mainstream social determinant of health model, Indigenous identity is often presented as a factor that negatively impacts one's health, However, our story for Indigenous identity represents resiliency, pride, endurance, original people, nationhood, celebrating diversity, self-determination, innovation, and spirituality. Looking at the culture, race, ethnicity determinant of health, the diversity of Indigenous peoples across Canada is vast. Cultural diversity within the Indigenous population should not only be acknowledged and respected, but celebrated. Recognizing the concept of intersectionality across our peoples acknowledges and respects that we are all related. From an Our Story perspective, the sexual orientation and attraction social determinants of health is a celebration of diversity and strengths, honoring the gifts of everyone. Welcoming and celebrating all forms of love is at the core of ensuring well-being. Through our story, gender identity is considered self-expression that is personal and the source of our sacred power. We as individuals are the experts of our own story and experiences. Supporting and welcoming the diversity of our peoples is crucial to ensuring the well-being of our communities. For social support networks, our story redefines the social determinants of health as including ceremony and healing circles, as well as including family and all health planning, creating physical spaces for gathering, making connections to culturally appropriate services, clan teaching, child care, elder care, and knowledge sharing. With regards to the social exclusion and inclusion determinant of health, our story looks at the 7 grandfather teachings, which include humility, bravery, honesty, wisdom, truth, respect, and love. Final social determinant of health that was reviewed and redefined is access to health services. This is a particularly important social determinant of health for First Nation, Inuit, and Métis. Our story defines access to health services as having access to traditional healers and care, which include plant medicines, land-based care, access to ceremony, and access to Indigenous practitioners. It also means having availability of appropriate services to meet needs in both remote and urban areas, with clear health pathways outlined to support health needs across the province. Further to that, our story redefines access to health services as access to high-quality care that is inclusive of empathy, dignity, respect, and safety. Access to care that is free of anti-Indigenous racism and discrimination. Access to care that is trauma-informed, recognizing the role of colonization as an ongoing root cause to current-day health disparities. After learning today about our story on the redefining of mainstream social determinants of health from a First Nation, Inuit, and Métis perspective, we want to emphasize the importance of understanding the resiliency and strength-based approach lens when providing care to First Nation, Inuit, and Métis clients.